Did you know 1 in 26 Americans will develop epilepsy in their lifetime? Also, an estimated 3 million Americans and 65 million people worldwide currently live with epilepsy. So what exactly is it? Here to explain is Dr. Gregory Casino. He is a neurology and epilepsy specialist. Thanks for joining us. Good morning.
Thank you very much. Nice to be on it.
So now, from my understanding, there are different forms of epilepsy, right?
Well, there are many different types of seizures, and we kind of think of the seizures being like the pigment, and the diagnosis of the seizure disorder is like a painting. So one patient may have multiple types of seizures. There are two main types of epilepsy. There's focal and generalized seizure disorders, and each may present in a different fashion in terms of their typical symptoms.
Wow. And as I said in the intro, millions of Americans live with epilepsy, but how would you describe the daily life of somebody with this disease, living with epilepsy? What is it like?
So as you correctly recognize, Stephanie, about 3 million Americans have a seizure disorder. And we used to think of epilepsy as being recurrent and unprovoked seizures, but even patients now who have a single seizure but have strong evidence for a likely seizure recurrence are many times treated as if they have a seizure disorder or epilepsy. And those terms are synonymous. The good news is that if we have 3 million Americans with epilepsy, a significant number are seizure-free on currently available therapy. And I tend to say in general, our goals are no seizures, no side effects, no lifestyle limitations. And we do believe that about 2 out of 3 individuals will have a good response to anti-epileptic drug therapy. And many of those individuals are able to live very participating and productive lives, operate a motor vehicle, work, etc. So our goals, of course, are success, and that can usually be achieved in about 2 out of 3. Unfortunately, about a third of the patients may have seizures that are difficult to control, and we have to think of other strategies to render those patients seizure-free.
Now, is epilepsy something that someone is born with, or is this something a person develops later in life?
An excellent question, because there's a lot of misconceptions. A seizure disorder can begin at any time in life, from day 0 to 99 years of age. And the two most vulnerable populations for developing epilepsy are the very young and the very old. And probably the fastest rising group right now in the United States are individuals over 65 years of age. So there are some individuals who will develop epilepsy at a very young age, and they may continue to have seizures in childhood or adulthood. But other individuals may not experience their first seizure until later life. So we're never completely at no risk. And part of the reason that there's a disparity in age is based on the underlying causes. So the causes in a young child would be different than an elderly adult.
Well, and the good news is treatment options are on the horizon, right, Dr. Casino? So what can our viewers do if they or maybe a loved one wants to take advantage of these treatments and learn more about it and where they can go from here?
Well, and I think that's an excellent question, because when we make the diagnosis of a seizure disorder, I always emphasize to the patient education and counseling. There are many misconceptions and there are many wrong ideas about epilepsy, and we emphasize that it's a neurologic disorder. It's very treatable in the majority of patients. They do require appropriate evaluation and therapeutic interventions. And the goals are no seizures, no side effects, no lifestyle limitations. And the more the patient knows about the disease process, if they're armed with information, I think the better care they receive. I find a website, the Epilepsy Foundation of America, I believe it's efa.org, as well as the Mayo Clinic website, to be very informative for patients. But there's many others of them, and I think the patients should look first at the Epilepsy Foundation of America, a nonprofit organization designed to arm our patients with information and give information regarding different therapeutic interventions that are available.
Good to know there are options out there and that it is manageable. Thank you so much for taking time to lend your expert advice today. And if you want more on what Dr. Casino spoke about, we'll have this interview posted on our website at fox4morningblend.com. Up next, live the life of luxury. Whether it's your home, your driveway, or even in your glass. Coming up, we're making a list and checking it twice with ideas to stuff your stockings. Stay with us.